Okay. All right. A very good morning to all of you this morning that have joined us virtually and in person for this important event. My name is Mxolisi Sibanda, and I am Advisor Climate Change at the Commonwealth Secretariat, and welcome you to our event this morning, Closing the Gap, Climate Finance for Health in a Warming Commonwealth. As the world edges towards 1.5 degrees Celsius, one of the things that has become more and more apparent is the fact that climate change is not just affecting life, as in disasters and such things that we see, but it is affecting human health as well. And our event today tries to spotlight that crisis, impending crisis that is already happening actually, and we coming on the heels of developments within the UNFCCC process, COP process, building from Glasgow to Dubai, where we had a climate and health declaration. And since then, at the World Health Assembly in May, the nations of the world agreed that the climate health nexus is more important than ever before. So this event comes at such a critical juncture, and we are very, very delighted as the Commonwealth to be making some contribution to the topic and making some, taking some actions on the ground around this topic. Just a little rundown of what will happen this morning is that we'll start off with a presentation of the early findings of a study that we've been doing on the climate finance gap in the health sector. And then after that, we will hear an address from Ambassador Kennedy, who will speak on that topic, passionate topic of the climate health nexus. And then we will have a panel discussion. And we're very, very delighted this morning that we have a number of experts that are with us, and we'll introduce them a little later when that opportunity comes. But we're looking forward to a discussion, and those of you that are joining us virtually, we hope that you can either write comments on the live stream or get in touch with us, and we will be more than delighted to engage with you on this very, very important topic. So without further ado, I just want to share some of the findings that we've had from the study that we've done. In terms of context, I just would like to make you understand that for us at the Commonwealth, we're doing this sort of work under the aegis of what we're calling the Living Lands Charter. And this is an agreement that the Commonwealth heads of government had or agreed, adopted at the 2022 CHOGM meeting in Kigali, Rwanda. And you will see that it tries to work at the intersection, it aims to work at the intersection of the three Rio Conventions. So the CBD, which is the Convention on Biological Diversity, the UNCCD, which is the UN Convention on Combating Desertification, and the third one is the United Nations Framework Convention on Climate Change, which we've gathered here. And across those three conventions, some of the key topics, areas that are really, really quite critical there are what we are calling our thematic areas. And across each of those, we're looking at a variety of issues, including knowledge generation, sharing, and management. We're looking at the financing gap because we understand, we know that across all these areas, there is a huge financing gap. Health is one of those areas that within the Living Lands Charter is a key area of endeavor, and hence the work that we are doing and this morning's event. Okay. Right, I think, oh, I think my presentations, my presentation has gone off. So as we try to sort that out, I was just going to say, so health is one of those key topics that we're looking at. Health is one of those topics that we're looking at, and I'll just turn to my computer for the presentation. And in our interaction with the countries of the Commonwealth, it has been one of those that has been clearly indicated as a key priority. And I just want to mention that at the last meeting of our health ministers, which was in May, ahead of the World Health Assembly, our health ministers resolved that this is one of the key issues that needs to be tackled. And so we are, on the back of that, really working very hard to do a number of things. And you might realize that on the slide there, we've got a couple of things that we are working on. The first one is we're doing some research, and the results that are going to be presented here are the initial findings of the climate finance study that we're doing, looking at the Commonwealth countries. And in addition to that, we're working with the WHO and other partners through the Alliance for Transformative Action on Climate and Health, as well as recruiting specialists in this area of endeavor. In particular, a lot of our countries where we work on this, we're supporting with the pipeline of projects, the development, the design and development of projects around climate and health. And so, for example, in Seychelles, we've deployed an advisor, and we already have a climate health advisor that's really supporting our countries to try and close the financing gap, as it were. We're not starting from scratch. There has been some work that has been developed, and through the Commonwealth Climate Finance Success Hub, where we have projects that have implications on health, whether it's the climate public expenditure tagging, the institutional review that was done in Eswatini. We've had a project, a 1.6 million grant in Tonga from the GCF to fund adaptation planning, and that includes an element of health. So we're not starting from scratch. It's early days as the attention has increased on this topic, but we have somewhere to start with. So a lot of you will understand why we're doing this. Obviously, as I have said in my opening remarks, the impact of climate change on health is growing and increasing. with the frequency of disasters, the frequency of floodings, heat waves, and on all of those things, not just on people's health directly, but indirectly through vectors, impact on vectors, whether they be insects or water issues. But what's apparent, according to literature, is the fact that there is a gap for us to take action on minimizing, eliminating, where possible, the impacts of climate on health. It's also worth noting the fact that whilst, of course, climate is impacting health systems, but also the health systems are also impacting our climate, because there is production of gases, whether it's through the development of medicines, the use of electricity in hospitals, and machinery, hospital transport, and the like. So the relationship between health and climate is really on both ways, both in terms of the climate impacting, but also on health systems themselves impacting on the greenhouse gas emissions that cause climate change. So we've done a study to really understand, as a first step, what's the status of things in terms of financing for health within the Commonwealth. And we did this study, and in a number of countries, Africa, across all the regions, Africa, the Caribbean, Europe, the Pacific. So a very good representation of the Commonwealth, as it were. The Commonwealth, if many of you might not know, brings together 56 countries with a shared history of the British colonial, but going beyond that, we have shared values around democracy, around peace, and the topics of environment have featured in a long history since the organization was formed. So for this study, what we did is that we interviewed, did surveys, an online survey, and in addition to the online survey, we also did interviews, structured interviews with experts in the different countries. And we are asking questions around where things are in terms of financing for health, how that topic is being tackled at the country levels, and our findings. We did a thematic analysis of the response, looking at the readiness of the countries' financial readiness to tackle this topic. And then we looked at whether countries had a pipeline of projects, particularly to the GCF, which is the premier funding institution for issues to do with climate. And then we looked at cross-country regional supporting mechanisms. What are the resources for them to develop projects? What is there technical support in this area or not? What are the budgetary allocations in the countries for tackling climate health issues? We also looked at the progress of developing health-related strategies. So these are the health national adaptation plans for each of these countries, and also whether in any other plans there has been integration of health and climate. And then the other last point that we did was we looked at emerging innovations. What are there innovations that are becoming apparent that others could learn from, that could be shared out of what countries are going through? So what I'm presenting today are some of the initial findings. And they might not be rocket science, but I think what's really, really useful with this is that it's really bringing out the reality and the status of things on the ground. The first finding that we've had is the fact that actually countries are facing recurring crisis as a result of climate, and particularly impacting on people's health and the health systems. And it's clear, in order to tackle that, there has to be expanded access to finance to provide, answers to those challenges. However, as we spoke to colleagues and experts around, it became apparent that a lot of the support for the recurring crisis is really coming through as humanitarian support. And so I think it behoves the sector, those of us working in this area, to look at funding, not just from, just climate sources, but also looking at the humanitarian part as well, and how we can bring it in to address climate health imperatives. So the second one was around issues to do with procurement. And this is quite important because quite a lot of the emissions from the sector come through from the procurement of medicines, machinery, and the like. It's actually in most of the countries that we looked at, this is an area that needs to be systematically tackled. There have been other countries, such as the UK, that have gone ahead, but in most countries, their procurement systems are not prioritizing climate imperatives. They are looking at it from a price point of view. And you can understand, in constrained financial circumstances, that's what's important. But I think it's important that authorities and national governments begin to look at their procurement systems to make sure that they begin to address health imperatives, climate imperatives as well. There is also lack of specific budgetary allocations for climate change, adaptation and mitigation of the health sector. And I think those of you that work in the health sector, it probably is an important element, because I think if this issue is not raised as important, it is not going to be budgeted for. And if we don't budget for it, then the importance of tackling it is reduced in the policymakers' minds. Capacity and coordination was another issue that we looked at. Staffing shortages of people with expertise in the links between health and climate, and not just limited staffing, but the technical expertise available to help build capacity is quite low in terms of that. And from where we sit, we think that huge capacity building efforts should be done on improving knowledge, and not just that, but also coordination between different line ministries where the nexus is. Data availability was something that we thought is quite clear. There is still very, very minimal data. And so we're hoping that this study will add to the data that's available, showing the gap around this area of endeavor. So despite all these challenges and some of these findings, I just wanted to highlight that what we also did realize was that there are some, points of light, as it were. For example, Fiji has developed guidelines on climate resilient healthcare infrastructure, which is brilliant. I've since then gotten to know that Australia has also developed a policy document and a plan around climate and health as well, which is brilliant. In Dominica, there's been a revision of the building code, which is quite important in ensuring that buildings are resilient to the impacts that climate is bringing on areas, regions such as the Caribbean. In Eswatini and St. Lucia, climate budget tagging is beginning to be implied, and that will give us a good estimate of how much money is going into tackling the climate health nexus. A number of things were also apparent. There's been use of parametric insurance policies that are helping, and in terms of capacity in the University of the West Indies, there's been a climate change and health leaders fellowship program. And these are small steps, but very important steps where we can learn from and begin to maximize on those going forward. Overall, what would say from the analysis that we've done so far is that there is urgent action that's needed to close the financing gap. There is line ministries working in different directions and need for coordination across ministries. There is need for improvement of data, and data is so critical in ensuring that there is justification for addressing this. We are using the findings from this to start early actions on our end, where we are working with countries to develop projects, to work on policy issues as needed. And we're using platforms such as our own Commonwealth Climate Finance Access Hub to develop projects and boost funding for the climate health nexus. So these are the actions, the overall findings that we have from this, and we're quite keen to engage this morning with the experts that are here to look at that. But before we do that, we would like to invite Ambassador Kennedy from Grenada, who has been working on this particular topic for a number of years, to just give us some remarks on this topic. Over to you, Ambassador Kennedy.
Thank you, MX, and good morning to colleagues at the presentation table and those in the audience, those virtually. This morning I'm going to take a look at the issue of resilience, look at it within the context of the components of our health, of the health system, examining the barriers and opportunities for increasing the financial flows that would improve the efficiency and effectiveness in having a resilient health system. I will then take a look at what sort of support is needed from the partners to build a resilient health system, and the context in which I'm doing that is acknowledging that addressing the health system and its resilience is not something for the health sector alone, but it must be an intersectoral approach that addresses the goals of the health system to improve the lives of the population, and fitting it within the context of the climate situation in the world, and framing it within the context of the Sustainable Development Goals. Now, when we talk about resilience, resilience is not really a byproduct of the investment and delivery of healthcare services, but it must be intentionally programmed and developed within the context of the particular country. And this has to be done through targeted inputs and investments. Resilience is critical to having an effective health system to address the needs of the population. A resilient health system must ensure that countries can effectively prevent, prepare for, detect, adapt to, respond to, and recover from public health threats while maintaining a quality, essential, and routine health services. It is important to repeat that resilience must be intentionally prioritized and operationalized. It must have the necessary investment and contextualization using that intersectoral approach, acknowledging the social determinants of health and issues outside the health sector: agriculture, nutrition, infrastructure, climate, environment. All these things have an impact on your health. To do this, health leaders at all levels, at the community level, administratively, in our hospitals, in the allied health services, they must be knowledgeable, adaptable, and be strong team players in making sure that we can achieve these goals of universal health coverage, health security, and the concept of health for all. And of course, working within the context of the SDGs, help countries to take that in a holistic way. For any health sector to be strong, having a strong economy is an integral part of that. A critical element to build resilience in a strong health system, which consists of the people and actions whose primary purpose is to improve their health. To increase the financial flows, we must examine the components of the health system. And as I look at the different components of the health system, I will integrate the whole issue of financing and climate, because in all areas, financing is a cross-cutting issue. And as we look at it within the context of climate change, I will try to show the connections. When we look at the health workforce, that is, in my opinion, the most important element in the health system. The people who work at the hospitals, in the primary healthcare centers, in the communities, in the allied health services areas, we have to realize that our workforce is critical. Climate change affects the workforce in so many different ways. As we speak today, my home country, Grenada, has been suffering with a number of floods which resulted from heavy rains over a 24-hour period. It impacts the ability for health workers to go and do their work, but it increases the risk of health problems associated with these floods. So our health workers, our health workforce must be given attention, and in order to improve the skills, improve the expertise, you need financing to provide not just academic university training, but training on the ground, training and working with communities. So the health workforce is an important component of the health system. The workforce are the ones responsible for delivering healthcare, and the sort of healthcare services you deliver, whether it's at the community, primary healthcare level, at the hospital, those services contribute a lot in terms of the strength of your health system. MX, you mentioned the whole issue of technology and medical supplies. That has an impact on the health system, and what we procure and what we use in the health system has an impact on climate change. We are currently looking at the designing of a new hospital, and this has to be done within the context of a smart hospital. When we look at our medical centers or health centers, we have to ensure that they're equipped with technology that is not depleting the environment, but are efficient technologies that would reduce the impact of climate change. When we experience a hurricane and buildings are destroyed, it prevents the health workforce from delivering adequate care. So the infrastructure, medical supplies, technology is a critical element, and of course, again, to address it properly, you must have adequate financing. Health information, data, the importance of data, and again, relating with the academic institutions to ensure that we can do the research and get data that would help in making and actually helping in terms of knowing what is going on. Data would help you see your epidemiological and demographic transition. What diseases are becoming more prevalent? Antimicrobial resistance is becoming a big thing, which might not have been such a major issue 20 years ago. So health information, again, has to contribute to us understanding what is happening and getting a better idea what to do. Healthcare financing is critical and it cuts across everything. However, the way a health system is financed makes a big difference in terms of access to care and the ability to have a resilient health system. Government expenditure tends to be a big component and tends to be the largest component in many countries. But when you have out-of-pocket spending being more than 10-15% of your health expenditure, then it's a big problem. In India, almost 50% of health expenditure comes out of pocket. People tend to use the private sector health services a lot because of the lack of confidence in the public sector. So we have to strengthen the public sector, improve the efficiency and competence so that the public can have confidence in utilizing public. Leadership and governance, again, is the bind that holds it all together. Because unless you have knowledgeable, adaptable team players leading at all levels, you would not be able to achieve the goals as we should. So the health system is responsible for providing all these services, and there are a lot of challenges that we confront. We remember not too long ago, the whole issue of COVID gave countries a lot of stress because we had to adapt, shift resources, and deal with the global pandemic. What is happening in the environment? I made reference to the floods, the hurricanes. These sort of issues keeps back a country from making the sort of progress, and that is where collaboration with the international community, the multilateral financial institutions are critical in terms of providing the resources to deal with these critical issues. So the opportunities are there. We have a lot of information available to us on the internet and through research and so on. We have strong relationships with PAHO, WHO, the Commonwealth, and other agencies that have the expertise to give us, and I see that as opportunities. But we have to build relationships, we have to plan and work together so that we can really make the progress that we deserve. Today, we're confronted with the reality of artificial intelligence. And more AI is being integrated into the health system to really give you better analysis and understanding. In the area of radiology, I know this is a big area where AI is contributing to improving the timing in which you can detect problems and so on. So training of the health workforce, making them understand what is going on in the field of climate and public health is critical to us really making the progress in building a resilient health system. What support then do we need from our partners? First and foremost, I think it is important to have good communication, transparency, and communication based on trust and mutual respect. With the technical support that the partners can provide to us, we must ensure that we have the necessary human resources at the country level to be able to benefit adequately. And we must put the conditions in place to sustain and retain our workforce. Because one of the realities is that when opportunities arise in other countries and other organizations, the home country tend to lose the skills and the talents and the expertise that sometimes they spend a lot to cherish. Technology transfer, how we can use not just high technology, but how we can use technology that is more climate friendly and contributes to improving the efficiency of the workforce. And of course, financial support is always needed to address all elements of the health system. So I'll conclude by emphasizing that resilience will not happen automatically. It must be prioritized, planned, and well executed. Strong, efficient health systems is critical and necessary as a prerequisite for having resilience. And that intersectoral approach is needed to work with the private sector, the NGO sector, and regional and international organizations, and learning from each other, especially in the small island development states. That strong collaboration will help in generating financing, getting financing, but it is not only the money that is important, but is that level of understanding that each health sector is different, each country is different, and we must take a unique approach to working with countries to build that resilience. So I want to thank you, and I hope that just sets the context of resilience in health systems and that nexus between climate change and the importance of financing to get this all done. Thank you.
Thank you very much, Ambassador. That's over 30 years of experience as a government minister, permanent secretary on issues related to health. Thank you for that very, very good overview of issues relating to the climate health nexus. Just to move us on because of our time, we've got 3 other experts that I'm going to pose questions to on the back of what Ambassador Kennedy has just shared with us. And I will start with Jeremiah. Jeremiah Mshosho is the regional team lead on climate change, health and environment at the Africa WHO regional office. And Jeremiah, I just want to ask a particular question to you. What key priorities have emerged? Because recently you had a climate health Africa meeting. I think you've had 2, one in Senegal, one in Harare, and a declaration has come out of that. And what has emerged from those sorts of meetings, and what's the trajectory of travel from here?
Thank you very much, Mr. Sibanda. Good morning, everyone. Thank you so much for this particular opportunity to speak. It's very refreshing to learn that elsewhere other than Africa, we are seeing almost the same trends when it comes to the impacts of climate change on the health sector, and to see the issues, intersectoral collaboration, the need for increasing funding. I think it really resonates with some of the issues which we have seen. So as WHO Africa, we are coordinating a network of a think tank of organizations, African and international academic institutions, UN agencies, communities, and NGOs, who meet annually as the Climate Health Africa to set the agenda for climate change and health in Africa. We met last month in Senegal and we discussed a lot of priority areas. And earlier this month we were in Harare where we had the first Climate Change and Health Africa conference. And really 5 to 6 priority areas were coming out in terms of what we really need to do in Africa to strengthen the resilience of our health systems. So the first area we have seen is really the climate and health policy framework, where there is an intersection. We have health policies, we have environment climate change policies, but what is the concentration point? How do we link these two to make sure that we have a robust framework between these sectors, which speaks to the Paris Agreement, which speaks to the goals of the UNFCCC? So we have seen that we need to work around this particular area across Africa to strengthen the policy framework, because it enables actors to be able to then run with the agenda in terms of implementation. We have also seen a second priority area around data, evidence, and monitoring. We have seen that the evidence gap in terms of climate change and health impacts is in Africa. And we need to generate that evidence for us to be able to advise policymakers, to show them the evidence, for us to be able to showcase what is really happening within the health systems when it comes to climate change. So that is a gap, and we agreed with the stakeholders that we need to implement interventions to close that particular gap. Thirdly, we have seen that areas around capacity building and training is an area where we need to work on. First of all, working with the healthcare professionals to make sure that they are trained, working with the policymakers to make sure that we provide them with the data, the evidence, and the decision-making tools for them to implement issues at the intersection of climate change and health. Communities themselves as actors, as those who are affected, we need to ensure that we empower them, we give them the tools for them to be able to adapt to climate change. Number 4, we've seen that community and stakeholder engagement, especially during policy making, is very, very, very critical. We want to emphasize on community engagement because this is where the impacts are happening. This is where we expect the actors to actually be able to be on the ground, to act, to be able to adapt to climate change. So we really think that while we are designing policies, financing frameworks, research agendas, we need to engage with communities and stakeholders. Number 5, we've seen the need for interministerial and sectoral collaboration. Based on the brief declaration on environment, climate change, and health, we see that while collaboration is there, it's still weak. How do we then strengthen that? So we are working with African governments, member states, institutions to identify those areas where we can work together to really push the boundaries. And lastly, the priority area which we've also identified is finance. For us to be able to do the work, we need finance for us to be able to specifically identify concentration points between climate change and health. How do we leverage finance? How do we then accelerate and upscale what has been happening? What are the best cases? And how do we move forward from there? So the last part in terms of moving forward, I'm going to repeat what we have recommended via the Harare Declaration on Climate Change and Health in Africa, where we have identified key areas and key course of actions for funders on climate change and health. So the first area is for us to increase funding for research, capacity building, and technical support, especially in program development in countries in Africa. We have seen that capacity is still lacking within institutions, across organizations. So we need to accelerate and increase funding for those areas, especially research and capacity building. We've also called for reconfiguration of financing mechanisms to make sure that they are more accessible, flexible, and adaptive, aligning to the guiding principles for financing climate change and health adopted at COP28. This is very critical. Some financing mechanisms, they claim to have flexible arrangements, but we believe that they are still complicated, and that needs to be addressed. We are also recommending and calling on national and local government investment in climate change. So we need to make sure that governments increase local and governmental level investment in research, capacity building, especially building climate resilient health systems, looking at infrastructure. That is very, very, very critical. Fourth, we are calling for equitable distribution of climate finance to rebalance the distribution between adaptation and mitigation, and also geographical balance, because we know that there are regions which are the most vulnerable to climate change, and therefore financing mechanisms should respond, rebalance, reprioritize to make sure that we finance those who are most in need. Lastly,
Wonderful.
there's a call to action to prioritize loss and damage within the health systems. And system and operational framework has been put in place. But what does it say about the intersection of climate change and health? So this was the final recommendation and final call to action, especially for the financing mechanisms. Thanks, and over to you.
Wow. All very good. It augurs very well with the findings from our study as well. I just want to give just a couple of minutes to Clifford. Clifford Bastille is from the government of Seychelles and is a policy officer there. And Clifford, we note that Seychelles recently secured new funding, and we've been talking about funding in this event to support the development of its national adaptation plan. Could you just share your experience about that and how health is situated, located within that national adaptation planning process?
Good morning, everyone. I'm Clifford Bastille, a policy analyst for climate change in Seychelles. We've recently secured over $2.7 million to prepare our climate adaptation plan, and that process started in 2019, so it was a quite long process, and with the help of UNEP, the United Nations Environment Program, and with the Commonwealth, they helped us to write the proposal. So we asked, the proposal was asked of, with the Green Climate Fund. So they were the one that provided us the fund, and UNEP is helping us to implement the plan. But why is the National Adaptation Plan important for us? Seychelles, unlike our colleagues in the Caribbean or neighboring countries like Madagascar, Mauritius, Seychelles' climate change impacts are quite subtle, and it happens in ways that you don't really see. So we kind of quite protected from big storms and cyclones and all, but then we tend to get things like sea level rises and instant rain, and then in terms of health, we tend to get we have a lot of people that comes from outside that comes in. So there is a sort of like an exchange of pathogens that comes in once in a while that we don't see until we can see the effect of it. So for us, prevention is better than cure. And we have a very small population. The local population is less than 100,000. So everybody counts. So everybody matters. So if we lose one key person within the health system, we have a very big issue. So for us, prevention is really important. So, and this project, the NAP project, it will help us to strengthen our plan that we have already, because we've always have adaptation. I mean, in the Seychelles, we have always keep on top of our adaptation issues. And what really is important for us is to mainstream those work through the different sectors and create more coordination between us. So in order for the process to be more effective. And other things that are very important is we need to have more evidence-based solutions, and that will also strengthen the process. And like we've heard from our colleague on the panel, capacity building is a very important aspect of the entire process. So we need to plan forward. We need to be able to have a very robust, good plan. And then the most important thing is to secure finance for the current and for the future. So there has to be a good stream of finance coming in order for us to keep on going, because it's not an issue that can that happen once. It doesn't happen again. It's continuous. So like climate change is going to be with us for forever. So we need to adapt to it.
Wonderful. Thank you so much, Clifford. And I think what's quite interesting from what you've just said is the fact that actually we need to also be looking at prevention in our initiatives that we're looking at, particularly on the climate and health nexus. I think the last word this morning will come from Sumik. Sumik Biswas is the Regional Climate Finance Advisor at the Commonwealth Climate Finance Access Hub that I did talk about in my earlier presentation. And the Commonwealth Climate Finance Access Hub really works to support countries access financing, climate financing. And Sumik, you've been working in this area for a very long time. So from your experience, what resources and changes are needed in developing countries? Software, hardware, to close the financing gap, really. It's quite clear, it's there, everybody's saying more money, whether from Africa, from the Caribbean, but how do we do it? And from your experience doing this sort of work on the ground, what are the key things that need to be done and to move the dial?
Thank you, MX. I will start with the barriers that needs to be removed to get more climate finance into the health sector. I think the major barrier that we need to tackle is the blockage of thought within the health sector and how the climate change health interacts with each other. So whenever we are talking about climate finance in health sector, you will find an overwhelming response towards research on vector-borne diseases and such, which are going to be affecting the health systems in future, and you need to adapt to it. We do not talk so much about the resilience of the health infrastructure, which is outside the purview of the health systems per se, as well as the mitigation potential that the health sector has. So any hospital that you build, it's going to come with a parking place, for example, and you have that ability to build that parking place into a solar plant, which will in effect act as a resilience for the health system itself in conditions of climatic changes where it gets affected by cyclones and there is no power supply for a couple of days. So the system itself stands by itself. Then there is a question of access to the health systems in the effect of, again, climate adversities. So if there is a flood, the hospital may still stay above water, but the roads that are accessing the hospital and connecting it to the villages and the towns, they might go underwater. And that is not exactly within the purview of the health system, but is supposed to be part of the overall holistic planning that feeds into the health system. So we need to be, the adaptive part comes from, of course, the procurement and the vector-borne diseases, which we all understand. And all of these are held together by the capacity building initiatives that needs to be done within the health sector and outside, within the planning sector, within the governments. So the whole of government approach that we continuously talk about, we still are investing in health sector infrastructure with the data of yesterday for infrastructure for the future, investing today. We cannot do that anymore because the data of the past on the basis of which the health infrastructure was being developed no longer holds true under climatic conditions. So we need to have data of the future coming in where AI and other elements will be more and more important because they will feed into the system, feed into the data on what needs to go in developing a more climate resilient and climate responsive infrastructure. And then the capacity building part also needs to involve, we need to understand who, as you said, Ambassador, that the personnel who are working in the health system, the doctors and the nurses. Unfortunately, if we are focusing only on the doctors and nurses have no idea on the climate change part. And I would say not no idea, but maybe limited idea on the climate change part. And then when it comes to implementing the actual actions on the ground, they come up short. It's not their fault. They are not trained in that. So we have to find synergies between the doctors and the nurses, the administrators and the engineers simultaneously to take it forward. And this thought blockage is the first barrier that I would like to remove when we are talking about climate finance. Otherwise, we will restrict the climate finance that flows to the health infrastructure, health system, only to vector-borne diseases and research elements, rather than building on the resilience of the health system itself and to build for the future. So that I will stop here, and if there are any issues, I will take it up.
Wow. Wow. That's a wonderful point to end on. I think all our panelists today, from Ambassador Kennedy to Jeremiah, Clifford, and have emphasized a common thread. And I think it's quite critical that we start to think beyond just our own confines and interacting intersectorally. Start looking at, the resilience of the health infrastructure itself. And I think for those that are working at national levels, there is work for us, whether it's making sure allocations for climate and health policy issues are tackled at all those different levels. So I just want to say to our panelists, thank you so much for all the insights. It's very difficult to summarize all that you've said. We are very delighted that the government of Australia is live streaming this, and so we'll have a record to go back and reflect on it. And if you've been watching virtually, we thank you for being with us, and please feel free to contact ourselves or contact any of the panelists on the issues that have been raised. The issue of climate and health is something that affects all of us, and it will take all of us to work together to close the financing gap, and not just close the financing gap, but to create a resilient health system in the face of a changing climate. So once again, thank you to all of you that have joined us here in Baku, as well as those that have joined us virtually. Have a good day.